Brooklyn, children as young as 5 years old are now eligible to get the Pfizer COVID-19 vaccine. The announcement came down yesterday from the CDC. It's the news lots of parents have been waiting on. According to Pfizer, the vaccine is 91% effective for children. News 19's Tai Wong is joining us now from Prisma with more on what parents need to know. Tai.
With children getting vaccinated now or able to get vaccinated starting tomorrow, I spoke with some parents who say that they are actually against getting their child vaccinated. Now they tell me it's because they want to see more evidence on the effects that it has on kids and what tests were done. But one parent I spoke with today says she's actually excited to finally have her son vaccinated and won't be as worried when he goes to school.
My husband and I, our family, have been vaccinated. We're all in the process now of being vaccinated with the boosters. And so we've just been waiting on the final word from the FDA and CDC for 5-year-olds to be able to be vaccinated. So we're looking to get our son scheduled as soon as possible to get his first dose.
She says she hopes other parents also get their children vaccinated to prevent the spread of COVID in schools. Now, coming up on News 19 at 6, we'll hear from Prisma health officials on what side effects the children who get vaccinated might see. But for now, reporting at Prisma Health, Tai Wong, News 19 WLTX.
All right, Tai, thank you so much. It is definitely exciting news many parents were waiting for this final approval for the COVID vaccine to go to our younger children from the CDC. Now, as part of CBS This Morning, the director of the federal agency talked about what makes this dose so different from the dose you and I got.
Young people are not just small older people, and we need to, with all vaccines, we have different doses. With all medications, we actually have different doses. And so what they've done in these clinical trials is to look at dose de-escalation to make sure that the younger children are getting the right dose, both to balance the effectiveness and make sure that it's actually working well, and to make sure there were no side effects. And they absolutely hit that sweet spot at this dose.
Well, Dr. Walensky also shared with regulators on the advisory committee, reviewed a lot of data before making this recommendation. They did not take this recommendation lightly. They, of course, reviewed months and months of data on that smaller dose. And we know you have questions too. We wanted to speak to one of our own local experts. So joining us live in the studio tonight is Dr. Lauren Matthews, a pediatrician with Lexington Medical Center. And Dr. Matthews, you and I just had a chance to chat, and you were saying personally, as a doctor, from what you've seen, you are very excited about kids ages 5 to 11 now being able to get this vaccine.
Absolutely. This is such a huge milestone in our fight against COVID. Now we can help protect our children's health, but also we can help them get back to their activities that are so important to their emotional and mental development.
Dr. Matthews, what do you say to a parent who is on the fence about whether or not this is the right decision for their child?
Sure. Well, with any vaccine, there are definitely risks associated, but in this situation, the benefits far outweigh any potential risks. Additionally, the CDC and the FDA have gone through extensive data in all of the trials, and this vaccine was very well tolerated in the 5 to 11-year-old age group.
All right, you and I were talking, and you said basically this virus really exploded for our kids around the beginning of the school year. Talk about that and about what you saw and why this Delta variant really did affect the younger patients much more than the first variant.
Yeah, in our children, we saw a disproportionate number of new cases in this 5 to 11-year-old age group. In fact, COVID was the 8th leading cause of death in the 5 to 11-year-old age group. Over the past summer, we saw an extensive number of new COVID-19 cases requiring hospitalization, which was unlike anything else we had seen throughout the pandemic.
Yeah, certainly don't want to think about any of our kids being hospitalized, but we also got questions for you from Lexington County. We talked with some viewers there to see what they wanted to know. Let's listen in on this sound.
Would you recommend the vaccine for your kids?
Yes, I absolutely would recommend this vaccine for my children.
All right, and another viewer wants to know, how do you know if the vaccine is safe for your child? Did you test it on 5-year-olds to see, you think that the vaccine was tested on 5-year-olds to make sure that it was safe between kids 5 and 11?
This vaccine was absolutely tested on 5-year-olds. It was tested on every age group in the 5 to 11-year-old range. We have to trust the science and the data behind it that's saying that it's safe.
Another question for you. We've heard over and over from healthcare professionals that children are not just little adults. Can we talk about some of the side effects that will impact our children differently, or maybe even if they're the same as the side effects as adults had when they were first vaccinated?
Well, for our children, this dose in particular is going to be 1/3 of the size of the dose that the adults and older teenagers received. So because it's a smaller dose, we're thinking that the side effects should be less common and more mild if they are present. And those side effects would include the traditional or typical side effects that you would see with a vaccine. So redness around the site, tenderness, maybe some body aches, fatigue, but overall should be well tolerated, and those symptoms should resolve within a couple of days.
All right, I just want to ask you a question because I know that this is something that all the kids watching, now that kids are in school, if they get a vaccine on a Tuesday or a Wednesday, do you recommend that they go to the school the next day? Should parents keep them home to watch for side effects, or just play it by ear?
I think they should probably just play it by ear, but if they're feeling well enough, school is the place that they should be.
Okay, so that's it, kids. You don't get an excuse to miss a day of school. Thank you, Dr. Matthews. She's going to join us again in about 10 minutes to answer more of your questions. Of course, if you have a question you want her to answer, you can always text us at 776-9508.
And remember, we're the place to get all the updated information about COVID vaccines and your children. Go to our website, WLTX.com, or you can visit our mobile app. And you can also, again, send in your questions, 803-776-9508. Dr. Matthews is here through the rest of the newscast to answer those questions for you.